Hi, I'm Dr. Celia Dyer. I'm a general dentist in Atlanta, Georgia. Today I'm here to talk with you about missing teeth and what you can do when you have lost a tooth. The most commonly lost tooth in adults is the 6-year molar because it's usually had the most number of fillings, and you bite down on something and you crack the tooth and it breaks off below the gum line and into the bone, and the tooth has to be extracted. There are a couple of ways that you can replace that missing tooth. One way is with some sort of a little partial denture that has one tooth on it, and not many dentists would recommend that sort of treatment today because it puts a lot of pressure on other teeth in the mouth and on the gum tissue. It's hard to keep clean, and that's just more than you would need to replace a single tooth, but that is one option. Another option that has traditionally been the way you would treat this missing tooth is a 3-unit fixed bridge. And for that, the dentist would come into the mouth and reduce the size of the teeth on either side, and then have the laboratory make 3 teeth that are connected together that are then cemented on the teeth on either side of the space. And that's a fixed 3-unit bridge. The cost of that is about what you would pay for the third way that you can treat a missing tooth, which is a dental implant. The downside of a fixed bridge is over time it will wear, you will lose bone here where there's no tooth, and you'll start getting food caught under the bridge, and it will need to be replaced usually in about 15 years, maybe 20 years if it's a really well-made bridge. So depending on your age, you'll have to go through that expense and trouble again periodically throughout your life, and so that's something to consider. The highest tech solution for filling that space where there's a missing tooth is with a dental implant. Usually that would be made of something like titanium, covered in a special coating so that the bone actually sort of grows into that, and it's like replacing the root of the tooth. And so a dentist or an oral surgeon would place this kind of like a little screw actually into the bone through a little incision in the gum. And patients always are surprised at how quick it is and how relatively painless it is to have an implant placed. After a period of time, usually 3 or 4 months, a dentist then will have the laboratory make a tooth that is cemented to this artificial root, the implant. And then you can floss around it just like a normal tooth. It holds the bone so you don't lose bone through the years where that tooth was lost. And it's just almost like a natural tooth, and it should be a permanent lifetime restoration, again for about the cost of a 3-unit bridge. And so you also could do nothing, and if you left that space open, what would happen is pretty quickly the teeth on either side would start leaning into that open space, and it would cause the points of the teeth to come up in different spots. Your bite won't fit correctly, and over time you'll have 2 teeth that have leaned over into that missing space. So it's very important that you replace the missing tooth, and it's important that you find a good dentist to evaluate your teeth and help you keep healthy teeth for life. If you need a dentist and you don't have one, you need to go to appointmentcity.com and click on Find an Appointment and get together with a good dentist for that evaluation. I'm Dr. Celia Dyer, and that's your Appointment City Tip of the Day.